Okay, thank you,
That's
Pa.
nice. Okay, thanks. Wacha tungoje hao wengine.
Okay, sir.
Sawa. Okay.
Okay. Because it is very, very important that we continue with this meeting, knowing it addresses the very important people in our society, or our community. So before we begin, I would like to ask Pamela, open with a word of prayer.
Okay, can you hear me all? Hello?
Yes, we can.
Okay, thank you. Okay, let us pray. Father, in Jesus' name, we want to come before you this morning with thanksgiving and praise, Lord. We want to thank you for your goodness and mercies upon our lives, for watching over us during the night and putting us on your wake-up list this morning. As we embark on this meeting, Father, we pray for your guidance, and we pray for knowledge and wisdom and clarity of mind, Lord, and more so unity of purpose, so that we may be able to articulate the issues of SNOs in our communities and SNOs within our institutions, Father. We thank you for all the participants, and we pray for active participation. In Jesus' name we pray and believe.
Amen. Thank you, Pamela, for the prayer. Now, I would like to also take this moment to welcome Samuel to take us through the introduction, so that we are able to know who is who and where we are coming from. It is very important for us to know where you are, your name, and maybe where you are coming. Samuel, please take control.
Thank you. Thank you very much, Erica Emba and Mweni and Pamela. It's good to meet. I think for most of us, it's several months. So we are not that many. We can use the opportunity to say your organization and very briefly how you contribute to the special needs offenders. Yeah, let me see. I will use my list here. Faraja Foundation, you're next to me in the. Go ahead.
She stepped out. She's coming back. She'll introduce herself.
Okay, Dr. Orlando.
Okay, good morning, everyone.
Morning.
Yes, Dr. Orlando. I'm a psychiatrist at Mathari Hospital. Also currently the departmental chair for forensic unit, which interacts with the courts to assist the offenders who are mentally ill. Yes.
Thank you, Dr. Though we missed your face, don't want to meet in the street and miss out you at some point.
Wait.
You are able. I understand Zoom meetings, understood.
It refused to give me a straight face, but let me try.
Okay, okay. Joseph Gucho.
Good morning. My name is Joseph Guchu from Faraja Foundation. I'm a social worker at Faraja Foundation. As well, I assist in the programs coordination department. My interaction with special needs offenders is usually in reintegration of these ex-offenders. And I'm looking forward to the contribution of this forum to learn more about what others are doing, and also areas we can always improve in our areas of reintegration. Thank you.
Thank you, Joseph. I see Dr. Orlando is now visible. Though your camera is Iko hivi kambo, but no worries, we will get to see you nicely. Martin.
Okay.
Martin Waithaka.
So, hello everyone. My name is Martin Wathika from Kamili organization. In this, we are partnering with AICS and CAI. We've made up a consortium that tries to, improve accessibility to justice. As an organization, we deal with community mental health and the training of nurses. Very soon, I'm happy I've seen Mary Kaemba. Very soon we'll have trained officers, nurses who are working in almost all the prisons in Kenya. Currently, we have around 7 officers actually in training, and they should be joining the prisons by maybe next year. So it's good to actually be here, and let us see how we can be able to improve the status of mental health together. Thank you.
Thanks, Martin. Patricia Kirogo.
Hello, good morning.
Morning.
I'm Patricia Kirugo from the National Legal Aid Service. Our department is under the Office of the Attorney General, and it offers legal aid to everyone, including persons with disability and the vulnerable, marginalized, and the poor in the society. Thank you.
Thank you, Patricia. Honorable Rosalind. Rosalind, sorry. Hello, Mheshimiwa Rosalind. Okay, we'll come back to Pamela Onyango.
Hello, good morning, everyone.
Morning.
My name is Pamela Onyango. I work at the Probation and Aftercare Services Office at Mathare Hospital. And our role there is to provide reports to the consultant psychiatrists and to the ODPP and to the Power of Mercy Advisory Committee. And we also prepare offenders for release and for reintegration, resettlement and reintegration into the community. So that is, in short, what we do at Mathare at the forensic unit. Thank you so much.
Thank you, Pamela. That's been many months since I last saw you. Good to see you here. Yeah, Honorable Rosalind.
Good to see you too.
Good morning, everybody. I'm sorry I had problems unmuting and putting on my video. Somehow my mouse refused to respond and embarrassed me in the process. I apologize. I'm from the judiciary, and generally I would just say briefly that we handle cases of these sexual offenders once they are brought before us. Thank you.
Asante sana. Susan. Susan Nyasinga. Okay. Hopefully it's just the mouse and she'll figure it out. Murungi. Susan, you can now speak. Go ahead.
Good.
Susan, go ahead. You're muted.
Yeah, good morning, all of you. I'm happy to join you.
Okay. Oh, no.
To the society. Thank you very much.
Thank you very much. Sorry, Murugi.
Good morning, all. I'm Pauline Murugi from Kenya Association of the Intellectually Handicapped. I am a support person, and on the project, the consortium between ECS and Kamili, Kai's role is to pilot community-based rehabilitation and reintegration services in access to justice for persons with mental disabilities, and I am the project assistant. Thank you.
Thank you, Pauline. Well put. Washira.
Morning.
Morning.
My name is John Washira. I'm a probation officer at Mathare. I work with Madam Pamela on genetic reports for psychiatric offenders and the forensic units.
Asante Washira, asante sana. Charity Muturi.
Okay. Good morning, everyone. My name is Charity Muturi. I serve with Tunawiri CBO. We run a program with Pamela and Washira at the Mathare Probations Department, specifically at the Maximum Security Unit, where we have facilitated almost 100 sessions in mental health, life skills, entrepreneurship, fast-moving consumer goods, and so on. And we also have a program at 28thApril. Thank you.
Thank you, Charity. I have next Karaoke John. Karaoke, you're muted. Okay, as he tries to unmute Jackie.
Hey, good morning, everyone. My name is Jackie Thaga. I work for ADAT Foundation. So we work on matters of access to healthcare, education, and justice, mostly for parents of children and adults with disabilities. And we work anywhere within the country. Thank you.
Great. Good to see you, Jackie. It's been a few months. Thank you. Christine Odero.
Good morning, everyone. My name is Christine Odero. I work for Faraja Foundation. We work in the criminal justice space. We mainly do the reintegration offenders. And we are happy to be here. I'm with my other colleague. I don't know if he has introduced himself, but much later he will. Thank you.
Thank you. There's another colleague who we wanted to give her a chance. She's just stepped out again from her camera. Anyway, she can come and do it again. What's her name? So that we put it in there.
Okay, my colleague is Joseph Guchu.
Joseph already spoken. Your other.
Okay, thank you. Thank you. I came in a little bit late. I'm sorry. I had some technical challenges here.
Okay, no problem.
I think I saw Jen.
Oh, Jen is in.
She's in. She's
oh, yeah,
also
I think
stepped
she's
out
in.
a little bit.
Yes, I think she's in. We are three of us.
That's good.
Okay, thank you.
Okay, so I have Frederick Kouko.
Good morning, everyone. My name is Frederick Oko. I work for the Open Society Initiative for Eastern Africa, and we are an interested partner in mental health in Kenya. Thank you.
Thank you, Fred. I have Mary Natasha. Mary, you're muted.
Oh, sorry.
Go ahead.
Okay, good morning, everyone.
Good morning.
Okay, I'm an intern at AICS, and I would like to work with everyone to get a broader perspective about the special needs of health. Thank you.
Karibu sana. Okay, I think we're about to finish. Matthew Mutiso.
Good morning.
Morning.
My name is Matthew Mutiso, and I do reintegration and rehabilitation, psychosocial support. It's a pleasure.
Thank you very much. So let me see who's remaining. Felicia?
Morning, everyone. My name is Felicia Mburu. here as Validity Foundation. We do provide legal services to persons and under the instructions of persons with psychosocial, intellectual, cognitive disabilities.
Thank you, Felicia.
Good morning.
Morning, Jen.
Let me interject. I'm sorry, I'm all over the place, but I have two members of staff here, but I'm also here. And I'm sure Christine and Joseph have talked about Faraja. It's nice to be here.
Karibu sana, thank you. Who is left out? Teresa?
Good morning, everybody. It's such a great pleasure and honor to be here. My name is Teresa Njoroge. I'm here representing Clean Start, representing the imprisoned and formerly imprisoned women, and really looking forward to the discussion in regards to special needs. Asanteni.
Good to see you, Teresa. It's been another few months. Karibu sana. Did Kariuki John introduce himself? I've seen him do a text. Peter Waga, meanwhile. Peter?
Good morning, everyone. My name is Peter Waga from Kenya Association of the Intellectually Handicapped. Thank you.
Yes, Kariuki? Okay, Jay Winde. Jay? Okay, you're breaking a bit.
Good morning, members.
Morning.
My name is Njoroge.
Which organization?
My name is Moinde Njoroge. I'm with mental disabilities. Kai.
Kai.
And I represent Kai's members before the court in access to justice program. Thank you.
Thank you so much. I think just one more person. I'm also conscious of time. Christine, and then back to Mary Kaimba, you will finish it up, or Mweni. I'll hand over to one of you.
We have Dr. Juguna.
Oh, okay. It's coming. Dr. Njuguna Karibu, you can introduce yourself kindly.
Yeah, so good morning, everyone. My name is Dr. Simon Juguna, Director of Mental Health.
Thank you for being with us. Christine?
Good morning, ladies and gentlemen. My name is Christine Obondi, Deputy Director, Probation Headquarters, in charge of technical services. I'm excited to see the revival of SNOs, and I pray that these partnerships will take us to a higher level. Thank you very much.
Thank you. Because I don't know whom I will hand over to between Mweni and Mary. Let me just say thank you, everyone. I know usually we will have just say type in your name and we move on, but maybe there are some of us who have not been in this meeting for a while. It was just good that you introduce yourself, identify the points of collaboration, which is going to be very critical in implementing our plans. Do I hand over to Mary? Back to you. Mary?
To thank you in a special way for taking us through this very informative introduction, because now we realize that we have partners from almost every organization, and that makes a very good team, especially when we are starting or reviving this very important committee that addresses very, very important area in our community today. So without wasting time, I know that it's important for us to be reminded or to be taken back to what we discussed in 2018, but we are not going to read the minutes. We are just going to be giving highlights of what we discussed in 2018 so that we are on board on what we discussed then and what the way forward, because after getting the information when you're going to give us, now the new people will be aware of what is it that we are up to and what is it that we need to do in this Special Need Offenders Committee. So many are welcome to give us the highlights of what happened in 2018 in respect to the Special Need Offenders Committee that time.
Yeah. Thank you, Mary, and thank you everyone for coming for this meeting. Before I go there, I just want to remind you of the agenda. We are going to have those highlights that I will give. Then after that, we will have highlights on the mental health task force report issues that were will have joined us or has joined us, so she can give us that, or Mary, you can say something, and then we'll have a presentation on gaps and opportunities in current policy, legal and guidelines for strengthening community-based rehabilitation by IKE's partners, and then we will have a plenary after that. So briefly, we hope that we will have ended the meeting by 1 p.m. latest. So let me share the screen. I hope you can see that. Mary unaona? If you can see. Is it visible?
Yeah, it is.
Yes.
Okay, so welcome all again. The last time that we met as a multi-agency forum on special needs offenders in Kenya was on the 14th of 2018. This is 3 years ago. And you know, there are many reasons as to why we met, but again, as I'm sharing, these are some of the challenges that we are having in keeping the talking about. The list is there, if you can just go through it. But of course, it's fluid. It keeps on changing, and so these are some of the things that we will need probably to discuss. So we have offenders with mental illnesses, including substance use disorders, offenders with intellectual disabilities, children included with the law, physically challenged, women accompanied by their children in prison, probation hostels, intersex, elderly, foreigners, terminally ill. So that those basically form some of the major categories. I know there could be others, but again, just to know that when we speak about special needs offenders, that those are the people we are talking about. And of course, they are in the justice system. We could be having people with these issues, but if they're not in the justice system, then that is beyond our scope. Our scope is those that interact with criminal justice agencies. This committee, like I said, was formed out of a gap that we have this population of offenders in the criminal justice system, but really there's nobody who takes care of them. There is no conversation going on in the country about how to provide services, coordinated, efficient services to these offenders. And so the probation department moved the other agencies and put together and called the other partners in the criminal justice system and stakeholders and said, hey, we have this population and we need to think about them. Because if we don't, there's nobody else. We are the duty bearers. There is nobody else who's going to think about them. And we need to improve treatment and rehabilitation services for these people so that, because they have rights just like any other person that goes through the justice system, but they have vulnerabilities as well. And so if we do not plug them out so that we can give them the attention that they deserve, then they will tend to get lost and forgotten by the system, or the system assumes that their needs are met, and yet they are not being met. So one of our core objectives of coming together as stakeholders is to improve treatment and rehabilitation services for special needs offenders, then advocate for review of relevant legislation and policies. There are many out there, but advocate for having those policies and laws that tend to also speak to special needs offenders. Then enhance coordination. Coordination is still a challenge, but find out ways in which, from the time that a person enters the formal justice system to the time that they exit that system to reintegration back into the community, are we coordinated as a system? Are we speaking to each other? Are we sharing information? So those kinds of things. Then conduct capacity building of service providers. Without having the appropriate information, then of course it's difficult for a service provider like myself, a probation officer, for example, to be able to know what I need to do with a person who has special needs. And so capacity building is one of our objectives. Then conduct research. Research is very important. The last research that was conducted that was specific to special needs offenders was in 2011. This is 2021. Things have changed. And so we don't have what we might call the current research. Then, of course, engage in public and private partnerships for supporting, supplementing or complementing government efforts to provide services. That's why I'm glad that we have so many partners. So as you even come to this meeting, we invite you to kind of think about how you can support us as we provide services to persons with special needs in the justice system. So there are issues that we have paid attention to as a committee that we have been focusing on since 2011. And I'll just highlight some of these issues. One is we have our hospital, and I'm glad that the doctor from Mathare Hospital is here. We have Mathare Hospital, where a good number of persons who are convicted or are remanded there and have had various types of mental health problems. And one of the things that we keep discussing in this committee is how to work as various service providers converging there at the maximum security wing, how to work efficiently, how to even make that hospital, especially that part, that is our focus, to be more humane, to look like it's a place that, even though they have committed offenses, though they have done things that have, brought public outcry and all that, but that the hospital, as agencies, as government agencies and as stakeholders, how to make it be habitable. When we were at the Ministry of Home Affairs, did some renovations at Mathare Hospital, that security wing. We were able to enhance security by bringing prison officers there, because there's a time actually there was very little security. So because of the efforts of the committee and say, what can this department do? What can the other agencies do? Who can support this? We were able to do some of those things. Of course, there's some work that needs to be done, but as a committee, we can be able to think about that. The other things is also getting specific duty bearers or lead agencies or stakeholders to play their role in provision of services to special needs offenders. You know, we have different categories, as my colleague Pamela will tell you. There are those who have intellectual disabilities really, and they have stayed there for a long time. What is the role of the Attorney General? What is the role of prosecution? What is the role of probation in their reintegration? What is the role of the Ministry of Health, for example? So that as duty bearers, we don't forget about these offenders, especially those ones in that hospital and other hospitals across the country where we have those kinds of wards. So those are the conversations that we have that tend to move us to action. Then improving justice services for SNOs. We have had very many conversations about injecting some therapeutic jurisprudence into a justice system, so that some offenses that are as a result of underlying mental health issues are treated as such, so that the person gets treatment instead of getting punishment. We have had conversations about having specialized courts full with professionals. You know, we have made proposals and even benchmarked to look at how does a mental health court look like. A mental health court probably has a magistrate or a judge who is really fully trained in mental health issues, so that they will be able to know some of these things, even when they're reading a report from a doctor or a psychologist or a psychiatrist or a mental health professional. They have underlying, you know, the court environment, you know, the probation officers, the children officers, the prison officers, the lawyers, you know, the social workers, all those professionals who converge there. You know, we are taking cognizance that this is a special court. We don't have mental health courts to my knowledge, but those are some of the conversations that we have had. You know, we have children courts, but we also need probably youth courts. So so that kind of assistance, having evidence-based programs for these offenders. Then of course we have also had conversations about focused on research. And actually we have conducted 2 studies, one on special needs perceptions of service providers on special needs offenders in Kenya, and the other one was on the psychosocial, I think psychosocial profiles of offenders in Kenyan institutions, prisons and statutory institutions for children and youth. And so, but those studies were conducted some time ago. They were shared, actions were taken. So we keep on talking about the need for continuous research. Conferences and symposiums that tend to bring different professionals together, so that people can share information, can share good practices, can share programs, can share services that they offer. The last conference was held again many years ago. So these are some of the things we need to think about. Then how to handle stigma from the community. One of the challenges that we have in dealing with special needs offenders is stigma and acceptance, especially those that come from incarceration back into the community. So how to just create that awareness. Then assessment, clinical assessment, so that we can be able to really tell what kind of a special need does this person have. And this is one of the things that lack with service providers, that kind of assessment. Capacity building, like I've already talked about that, and then improving infrastructure in our institutions, in prisons, in probation hostels, in rehabilitation schools, in postal institutions, infrastructure for women living with their children in places of incarceration and all that. Infrastructure at the hospital and other hospitals where we have special needs offenders, training, empower these offenders, because sometimes they would finish serving their sentence, but they go back to the community. The house is not there, it was taken, the land was sold, the wife went away. So it's like they have to start life afresh. and they don't know where to start. So how we can be able to bring in partners to help us so that when we are taking back an offender back into the community, they don't relapse because of the stress that comes from having to start from nowhere, but they have somebody who works with them. Those are some of the issues that we are focused as a committee. Even as we focus on those, we are a big committee. As you can see, today we are even many. And this is an open, this is kind of an open committee where we keep on co-opting, but of course there are those key agencies that have been there since 2010. We work in small teams. The last time that we met in 2018, what we agreed is that we were going to work in 4 subcommittees. Subcommittee 1, research and data, then another one on policy and quality of services, another one on resource mobilization, and then have a coordination secretariat. To my knowledge, I think only the research and data committee met once. The others haven't, so we might have to reignite those committees again. I want to end by just mentioning some of the challenges that we are faced as we advocate for the agenda for special needs offenders and multi-agency working system. That one of the challenges is that there is no established system outlining the responsibilities of each agency throughout the justice process. We call ourselves a criminal justice system because a system is connected and a system is dependent on the other agency to do their thing, so that when the offender is going to another part of the system, then they've already received this service and they're handed over to this other organization to provide this service, and this organization knows what the other organization was providing. And so, for lack of a better word, I'll call it a lack of a through care kind of system. That, to my knowledge, has been one of the challenges. Then, of course, as a committee, people were appointed by the Ministry of Home Affairs then, and we have continued to exist through letters, just saying you've been appointed to be a member of the committee, but we lack legal mandate so that probably we can be able to work well. So we might need to discuss how we can ensure that as a special needs offenders committee, we have some legal backing, or we have some, I don't know what to call it, but we have a way in which whatever we decide, we even have resources and things like that. Then accountability of agencies to each other. That's been a challenge. So, just being able to say, hey, you need to do your part as an agency so that I can do my part as an agency. So that interdependentness and accountability has been another challenge. Of course, competing priorities against limited funds. So issues of special needs offenders may be put to the side because there are other priorities that agencies have. Then commitment of the justice system to issues of special needs offenders. That is something that needs to happen. And then of course limited research. So colleagues, at this meeting, we will have some kind of way forward, because we are kind of rejuvenating this committee again. Let us not get stuck in the Suez Canal. Let us move forward. We cannot afford to get stuck because offenders need us. They actually deserve our services. Thank you.
Thank you, Mweni, for that very informative presentation. And I'm happy that it has highlighted on very, very important areas that the Special Need Committee has always looked at when we are walking through this journey with these very important people in our society. And remember, as we think through, I would like us to really focus on our area of focus as we interact in this committee. The area of focus is very, very important because that will give us like an idea of exactly what we need to do to improve the services to these people who need the good services. At the same time, we should look at the challenges that we are facing in respect to improving the services of the special need offenders. And thank you, Mweni, very much for that. Now, without wasting time, I don't want to repeat what Mweni has said. I would like to welcome Dr. Njuguna. You remember there is a time there was a task force that was established, is it by the president or something like that, to look at the challenges on mental health. And I believe that we need to be given some highlights on what was discussed so that we are also brought on board on the areas that were they focused on. And with that, I'm inviting Dr. Njuguna just to give us a brief on the same. Karibu sana daktari.
So thank you very much. And as you have mentioned, I'll be giving some brief highlights from the task force report. And basically what I was asked to give highlights was on issues regarding criminal justice system. And I will ask Florence to share my presentation so that we can go through the presentation.
And I would like to inform the members that please let's take note of what Daktari is presenting so that if we have anything to ask, we ask after his presentation so that we really get informed of what he's talking about.
Okay, so thank you. So I'll just give very few highlights. I think when we'll be sharing from within the chat the link to the report. And basically, this was a task force which was constituted by the president and the cabinet to look at the mental health within this country. This was a follow-up to the presidential directive on 2019 on 1st of June that the various ministry led by the Ministry of Health and also county government and stakeholders to come up with a policy response to issues related with mental health. And this task force gave this report, which is titled Mental Health and Wellbeing Towards Happiness and National Prosperity. It was handed over to the government on 7th of July last year. Next slide. I'll basically look at only two mental health and legislative framework. I think those are two areas which are very important for this committee, the Special Needs Offenders Committee. And what the task force did was, as it met various stakeholders and various institutions, they were able to get what they called the key findings they found from the stakeholders. And after that, they were able to make various recommendations, which at this point, so sorry for that, more interruption. So the task force found that regardless that we are entirely the population with diverse needs within the country, they were able to identify some certain cohorts of the population or certain segment of the population as people requiring special needs as it comes to mental health. The reason for this was that some cohort of the populations are affected more by issues of mental health. Mental health affects everyone within the population, but some cohorts or segment of the populations are more affected.
We can't hear, or it's our audio.
Can you hear me now?
Yes.
We can hear you.
Okay, fine. There was someone who was having some challenges hearing me. That's okay. If the rest of the members can hear me, maybe the person can look at their volume. And these populations tend to be affected more. And what tend to happen is they go through what we call a vicious cycle. And eventually mental health has a very adverse impact on their quality of life. And so special attention is required for these populations beyond the healthcare systems. And I think this is one of the forum when it comes to special needs offenders, where we are bringing a multisectorial kind of approach, trying to address some of these issues of mental health within the special population. What also the task force found was that some of the population they found more affected by mental health, I will read some, but this is not exhaustive. They found the children, young people. When young people, we are talking about 10 to 24 years of age. They also found the older person, people within the correctional centers, the security personnel, the veterans, displaced population, survivors of violence, people living with disability, and LGBTQ community. So these were some population which the task force was able to see that they were quite more affected. But I know there is, God, this is an evolving phenomenon. Like now we are seeing the COVID pandemic and how it's also affecting the mental health of the population. So also the task force found that when they visited the correctional centers, they found there were very many young people, especially young people who are petty offenders. And among these young people who are petty offenders, some of the issues they raised were related to mental health. And so petty offenders within the criminal justice systems due to crime related to substance use or substance use addiction and other mental health related conditions. So that was one observation by the task force. Then also the task force found that there were quite severe adverse mental health impact of special needs offenders within the criminal justice system. So when you found people within the criminal justice system, whether they were going through the trial or they were already convicted, those with special needs, especially mental health needs, they were more adversely affected as they went through the process. Also, the task force found that a high number of people with mental health conditions within the correctional centers. And this was due to several factors. If you read the chapter on the special needs, mental health among special population, you'll find there were a number of factors which contributed to people with mental health conditions disproportionately contributing to a higher number of people within the correctional center. One was the perception within the community. Secondly was probably about the various policies and the laws we have that negatively affected them having a fair administration of justice. And so also we found that when these people are within the correctional centers, there were no adequate system to address their mental health needs. And so these also more resulted into more adverse impact in their mental health. So as we mentioned earlier, it became a vicious cycle. Next slide. So what are the recommendations done by the task force as regards to the special population? And specifically here, I just picked the special populations within the criminal justice system. The list is long. Florence, you can try to focus. I hope everyone will be able to see my presentation. Try to focus a bit.
By making
Or you can put it full screen.
Oh, full slide. Okay, I hope it won't disappear. My computer is really weird. How about that?
Yeah,
okay.
Yeah, that's good. That's better. So one of the recommendations by the task force was to increase the number of mental health care providers at correction facilities, and also to be able to conduct a screening of the various persons within the correctional centers in terms of their mental health conditions or any other mental health needs. and also be able to provide adequate care. The other recommendation was to develop and implement guidelines, screening tools within the criminal justice system. So let me first emphasize what we found, especially when we visited the industrial area prisons. We found that if there were guidelines and screening tools, and then we are able to build up the capacities of people working within the correctional facilities, working together with healthcare workers. As people come in, whether they're coming as remand or they are coming, waiting as they go through their trials, we are able to pick people with mental health conditions because they were there in the prisons, they were not picked. So we need these screening tools to be able to do that work. Then probably also some guidelines in terms of the care pathway and support systems, how once we are able to identify these individuals who have mental health conditions, they may have committed any other crime not in any way related, or they are not known to have a mental health condition, or they were known to have a mental health conditions. Then there are some guidelines on how we should process them within the prosecution, within their trials, and within the process of their sentencing, and later on integrating them, and also how they receive healthcare as they are within the system. So that was found that we need guidelines, we need the tools, and then also we make the process more user-friendly, really person-centered with a human rights approach. The same thing was found that we need something similar in schools, guidelines and tools, humanitarian settings, these are refugee centers, also centers catering for people who are survivors of trauma, the veterans within our community, and also within the security sector. So those are 3 areas. I think some work is already starting around some of these areas like schools and the security sector. And we wish to ask support from all of you. We maybe also need to develop these guidelines and tools within the criminal justice system. Third recommendation, or the other recommendation, was to the judiciary to streamline proceeding to ensure cases are disposed of in an expeditious manner in order to decongest the system and reduce stress due to slow judicial process. So when the task force talked to the people within the prisons, the remandees and other people, even at Madare Maximum Security Unit, this was a major observation. Most people talked about the process of the way the system works within the criminal justice system. They said they have been there for a very long time. Their cases have not been heard. And so we need to, and these increase in terms of their stress and worsen their mental health conditions. Even the other people within the prison system who may not have gone there with any mental health conditions, their mental health was adversely affected by the process in which the criminal justice system was working. Then there was the recommendation of establishment of special courts with the support of experts in mental health, whose specific expert brief may help in the fair administration of justice, access to mental health care, and as a result will decongest the criminal justice system. That was another recommendation. Next slide. So let's come to the legislative framework. The task force was told by Kenyans that specifically we must amend the laws which criminalizes suicide and also criminalize substance use and any other form of mental health conditions. So that was what Kenyans said, that there are some laws which were not very positive when it comes to administration of justice for people who are using substance or who have attempted suicide. Then the other recommendation in the legislative framework was on the Mental Health Act. Kenyans said that we need to align the Mental Health Act to the constitutions, to the provision of the Health Act, to the international law, especially the conventions of the rights of persons with disability, and also to address the emerging issues. You look at the Mental Health Act was enacted in 1989, and right now we are talking about a number of few things in the to address the issues of mental health. One of the recommendation was like the issues of having resources, the mental health fund, to be able to support the various mental health programs. And those are some of the recommendations, findings from the Kenyans. The other finding was that the system of forensic psychiatric services was actually dysfunctional, leading to many people with mental health condition not accessing health services, fair administration of justice, and fulfillment of their human rights. So this was especially when we visited Madari Hospital, and also people have also interacted with the forensic psychiatric services. They said we need to streamline the forensic psychiatric services, which means obviously we have to look at the various laws which need reforms. Some Kenyans laws were also found to be discriminatory against persons with mental health conditions and also persons with intellectual and other neurodiverse disability. The crosses were offensive, using derogatory language. I would mention some of the words we found in our laws, even in our constitutions. Person of unsound mind. We have seen words like imbeciles. We have seen various words, derogatory language used in our law. So basically, that was another finding. Let's go to the recommendations. So from everyone, one of the key was the Mental Health Act, and you're aware there is a bill in Parliament. I think there's some progress made around that. Then was to take all the laws and see these discriminatory clauses where there's a lot of negative language being used as regard mental health, and we should be able to reform those laws. So there's a Mental Health Act, and there's another group of civil and criminal laws which we just need together. We can be able to review them and amend these clauses. Especially we found Marriage Act. There's a provision which was putting one of the grounds which we can dissolve a marriage on the basis of mental health or someone having a mental illness. We found those things quite offensive. Then we also realized there are quite many provisions within the laws which have not been well enforced, and they could be helpful. So another recommendation was the enforcement of laws to ensure no discrimination, especially Section 46 of the Mental Health Act. It clearly stipulates that no insurance company will provide a medical insurance cover which discriminates on the treatment of any mental health conditions. And so those are some of the issues that we need to look at, some of the laws, NHIF laws, and all other laws which need to be enforced so that we can be able to make gains and address issues of special needs offender, especially persons with mental illness. We also found a number of laws which were in conflict. Many of the existing laws were, having various provisions which contradicted each other, or there was no harmony in their implementations, especially laws related to substance use, prevention and control. And so we thought of these laws need to think about them, the laws establishing NACADA, the laws on narcotic drugs and psychotropic substance act, the Alcohol Drink Control Act, and many other laws we thought needed to be harmonized so that we can have seamless implementation around these areas. Then we realized we need to amend laws relating to the criminal justice system to ensure people with mental health conditions are not discriminated, address issues of criminalizations of symptoms of mental illness. Here we are looking at like someone who could be having addiction to substance, maybe let's say use of marijuana, and they are found in possession of marijuana due to their craving, due to the withdrawal effect they were going through, and so they had to look for this substance. How do you treat that person compared to someone who is doing business in terms of supply of marijuana? But our laws don't put that kind of distinctions. Both of them may end up going through the same kind of trials and the same kind of consequences. So this should be looked at to ensure that the people with mental health conditions get fair trial, and then the system is effective, fast, and that will bring fair administration of justice. Yeah, so I think that's the key highlights I picked. I know there could be more. I will encourage most of you to read the report. I will ask Florence to share it on our chat, and I think that's it. So I'll be staying around for about 5 minutes for any questions or any elaborations you may require from me. Thank you.
Thank you, Daktari, for that very, very informative presentation. Actually, some of us read it. However, I'm just happy with the recommendations that you have highlighted. If these recommendations were actually implemented, then I believe that the special need offenders and other people would be well placed in our community. So thank you so much, Daktari. Daktari is going to be here briefly, so you're welcome to ask a question or whatever, the clarification or anything you feel you need to know more on the presentation. Anybody with an observation or anything to say?
Maybe if I can.
Hello. Yes.
Samuel here.
Okay. Okay.
Thank you, Dr. Thanks for that summary. It's true the report is available and we'll keep looking at it. But maybe from your summary, I miss out on community-based, systems for promoting, rehabilitation, reintegration. Why is that not very loud? Is there a reason why the committee did not find it, the task force did not find it to be that loud?
Yes, those are very good questions, and I think probably that's a missing point within the highlight. There was the aspect about, and I know one of the person who was in the task force member is here, Charity, and I know she's very key to that. The issues of rehabilitation, reintegration, the issues of social protection. I think it's also quite well elaborated within the task force report, the issues about how the special needs offenders, especially in terms of rehabilitating them and integrating them into their community, how we need to give them the soft and Charity.
Sorry, Dr. I don't know if that was my side, but your last few sentences, I think your internet or mine.
I'm saying also, I would also want to hear a word from Charity, who was also a member of the task force. But what I was saying is, I think that missed in my presentation, but it was also well picked. Especially, and I know probation officers are working, these are some of the areas, the aspect of social protection for persons with the mental health condition, intellectual, and other form of neurocognitive disabilities. The aspect of social protection was well covered. I think, Charity, is there anything you can add on that?
Yes, thank you, Dr. I agree with you totally that we did a lot of recommendations on that. And one of the issues that we pushed for is also improved registration or the relaxation of registration systems so that people like those in the maximum security unit who do not have IDs, and we are not able to facilitate IDs because other documents are not there, then they would still be able to be registered. And also after registration, then looking at what is it that these people need. So there's issues of housing, there's issues of rehabilitation, resettlement where possible, considering some of them will not quite be resettled back in their original communities, and so on. So we looked at it in terms of stigma. Of course, these people are also covered in the general issues of stigma, discrimination, access to healthcare, access to justice, access to employment, education, and social protection. So they are covered in other areas, but I'm happy to see that Daktari has, given what is specialized for special needs offenders. Thank you.
Good morning. Hello.
Go ahead, Christine.
Sorry, Samuel, I can't find where to flag my hand from my system today. Sorry for that crude way of seeking an interlude. Now, thank you very much, Dr. Njuguna, and I'm glad that you are part of this task force, because indeed, if I may recall, when we made the first attempts to conduct research on the prevalence of mental health types and perception, you are part of us. Now, my question is, there was a concern raised by Mweni that there is a huge gap, that this committee has not been anchored anywhere. I'm sorry, I may not have read the entire report. May we know from you and the task force that whether the bill provided for leveraging on linkages or made provisions for participatory approach, taking cognizance of both state and non-state players in supporting the government's provision of mental health care? Thank you. So that this committee therefore can be anchored somewhere. Thank you very much.
Yeah, so thank you for that question. Thank you for that question.
If you can combine that with a question related, there's a whole question around evolution and public financing.
I think a number of questions, and then I.
Okay, thank you. Okay, so let me just clarify. I was mentioning, again, maybe in this presentation, but even beyond the report, there are things that you pick out that sometimes don't come out in the report. How did you see the opportunity in county governments and looking specifically at public financing to be able to support the mental health programming? And again, back to my special area of interest on community approaches. Thank you.
Yeah, so thank you. Those are very good questions, and especially touching on the current mental health bill. So you remember Senator Sylvia Kasanga introduced a mental health bill in Parliament. I think this back in 2018. It went through the motions in the Senate, then it went to the National Assembly, eventually came back. And I know many of us have raised quite a number of issues within that bill with an aim to try and improve on the bill. And I know the conversation is still going on, and I think this time we are quite determined that we should be able to try as much as possible to make this bill go through. And I think that was one of the recommendations of the task force, that the few amendments and proposals coming from all stakeholders, we see how we can get them into the bill, and then we get this bill into finality, and it's enacted as an act of parliament, because we have been in this process for a long time. So the first section of this bill try to address the issues of the obligations, because as we realize we need, with the new dispensation, we have the county government, which is supposed to be providing healthcare services, and we have the national government, which has its own function in terms of policy, national referral facility. hear me now?
Yes.
Am I back now?
Yes.
Oh, sorry for that interruption. So what was there was that that is a key provision in this new bill, that we clearly be able to demonstrate that how at a multi-sectoral level, both the national, county government and other stakeholders should be able to work to be able to address the various issues of mental health. So that has been put up in this new bill. The second item was on the issue of establishing a board. Us as a ministry, we were even proposing, and even what the task force proposed was, we have had a board for a number of years, since 1989. Has it served us very well? Yes, not so well. So we need to think beyond what the board was able to do. And so now we were proposing for a commission on mental health. And so this commission would have representatives from the various sectors, the various stakeholders, and it become an umbrella body which coordinate, which advise, which give oversight. And so it will be able to bring that multi-sectoral kind of participation as we address the issue of mental health. Because one of the aspects of mental health, it's a cross-sectoral issue. Mental health is not just a health issue. And especially in the task force report, you look at, we looked at the determinants of mental health, and you look, they are either socio-cultural, they are economic, they are political, they are even environmental. So we thought having a board, a commission, now that we have a board, would be a better provision. So those are some of the discussion. The bill is still in open for discussion. Is now has gone through the second reading. It will be going to the National Assembly. The third item was on establishing councils at the county level. The Mental Health Act initially had provided for district mental health councils. That never happened. So the new bill has also provided for the council. I know this is a big ask, because when you ask for councils in every county, there are financial implications to it. But I think it's an ideal thing we need to push for. So I think those are some of the things in the new bill. The bill is still open for discussions. I will ask even this committee if they have their recommendations. I know we had the public participation for the National Assembly, but I know engaging the senator, engaging the clerk of the National Assembly and the Senate, we still can bring forth this kind of inputs we need to bring to this bill. Because once we do a law, probably will take another 10 years before we do another law. But this law is on the issues of the mental health care. We still can do other laws to address other issues of mental health. So it's not the end of the road for issues about mental health related law. But this will be the mother law, so it's very important. So back to you.
Thank you, Dr. Thank you.
I've seen Mutiso with a raised hand.
Yes, thank you, Madam Kahemba. Thank you, Dr. Njuguna. It's a pleasure again. And I've looked at one of the things that you've highlighted in your presentation is the aspect of petty offenses. And that has been our focus of psychosocial support especially to inmates at Jamhuri Prison. I'd like to hear your perspective on a subject that we are currently advocating for, is the decriminalization of petty offenses. And in regard, most especially from it being, apart from it just being an issue of socio-economic aspects of it, many of the petty offenses, like you've highlighted, there's a subject of mental health involved, mostly, especially when it comes to issues of abuse of certain drugs or alcohol in that context. I wish to hear from you, what will this committee need to do in that regard going forward? And in line with the notion that most of petty offenses, there's that underlying aspect of mental health involved. Thank you so much.
So thank you, Mutiso. I've also seen a comment from Felicia on, because I want to answer both questions together. The comment from Felicia Boro is on is in the Article 5 of the CRPD talks about equality and that discrimination. Isn't having special courts would be a form of discrimination? I think that's a good question. So let me come to, thank you, Matthew, for highlighting that aspect of the petty offenses and your effort in trying to see how you can provide psychosocial support to the petty offenders. Yeah, actually it's true. I think when we visited, and I know Charity, I think was with us, when we visited the Nairobi remand area, we found a very big population of persons within the prisons. And most of these people are young people, very young people. And probably majority of them, and I know people from prisons will comment on this, they are petty offenses. So the question was, if there was a triaging process, which probably is put within the law, and we have necessary policy and guidelines, when we are able to triage these individuals, we are able to take them through in terms of what is their health, what is their issues in terms of their criminal records, what is their background, another aspect. And then with the various experts, before even they go to the whole process of the going through the trial, we are able to see, is there a process? Probably, I don't know whether that would be a judicial process or an extrajudicial process. I'm not I know Felicia can comment on this as a lawyer. Then we are able to channel people in different pathways. And then we are able to make the process fast. We are able to fairly administer the justice. We are able to take care of the other needs which may have contributed to some of these crimes. So I think that's something we really need to put it down in policy, in registrations, and then we establish mechanisms of doing it. The second question on Felicia on whether that would be discrimination. You know, when we talk about discrimination, here we are doing for a good intention, putting people with special needs who have mental health needs separately so that intentionally we are doing something. So it's not causing any harm. We are not doing it with an intention of any harm. Someone would say probably it may stigmatize people by putting them separate, but we already have special courts on issues about children, sometimes issues on sexual offenses. So I don't think it would be a form of discrimination. But I know, Felicia, you can pick up a discussion on that. I know it could go on and on. Back to you.
Okay, thank you, Dr. Ari. I don't know how many more questions you can take. Can I have this Christine Odero on the line?
Can I have a batch of 3 or 4 questions and then I answer them?
Okay, Christine Odero.
Okay. Yeah, thank you, Madam Kaemba. Now, listening to the presentation and on the recommendations that have been presented, I just wanted, my concern was in the issue of normalization when it comes to mental health, especially, let me just mention, to be precise, the Madari Hospital. I wanted Dr. to maybe respond on what the government is doing, especially on the issue of safety in terms of normalization and the rehabilitation of the clients there, because the last time I checked, the conditions there were not very good. And I know mental wellness goes hand in hand with normalization, improved infrastructures and all that. And then also under the recommendations, there was the issue of a recommended mental health screening and adequate care. And this one, I will specifically refer to the criminal justice, the Kenya prisons. You know very well that the issue of maybe during reintegration, just a lot can be done, but there is need for the expertized screening and psychiatric interventions, and that is lacking, as the ministry considered that, because recently there was a case of a young man who seemed to be very okay, but he was released. And then 6 months down the line, it became very harmful to the society. That just shows that something was lacking. If there can be something like a help desk where the whatever long-term offenders, people have been inside prison for like 30 years, can go through screening and, you know, as an assessment as a pre-release intervention. That would be nice. Then I know this is maybe a conversation that has not been explored, and if it is something that can be included in the recommendations, I think it would be nice, because we cannot say that specifically, we cannot pin that for mental health or whatever clients, these are specifically the ones. And we cannot also say that it is only narrowed to special needs offenders. And then my third question would go to our concern on the involvement of the ministry when it comes to mothers and the children being accompanied by their mothers, and also people living with HIV, or how far. So maybe it's all in a mix, but these are relevant concerns. Thank you.
Any more before we, Dr. responds?
Yes, could I ask a question?
Can we have the last one?
Okay, can you hear me?
Yes.
We can hear you.
Thank you so much, Dr. I can see that the task force did a lot of work. One of my questions, I think most of them have been dealt with. I had interest in how some of these offenders would transition back to society. But I think you addressed that one. The other, my issue was about the maximum security unit, the only forensic facility we have in this country, and yet we don't even know which side of the divide it belongs to. Does it belong to the prison? Does it belong to the hospital? And I'm not seeing any recommendations that was done on that issue. Yeah, I just need a clarification. Okay, thank you.
Dr. I think you can answer that, but I just wanted to add something small on one of the questions they have asked. As much as they are talking of reintegration, you know, it is important to put in place an exit structure. How do we prepare the exit structure? To me, that is very important, especially for the people with the challenges. And that is what is lacking when it comes to our institutions, and especially Mathare. Yeah, so something like that is quite relevant.
Okay, so thank you. I think those are very good questions, and I also seen some a bit of conversation going on in the chat. So probably I will start with the question on the issue of safety, patient safety, and as you know, patient safety is a whole big subject. We know when you talk of patient safety, the issue of safety can come from various factors, from the condition, from where the patient is receiving the treatment, from the person providing the treatment, from the aspect about the treatment itself can have an issues of safety. So, and this is a key area within the ministry. We have a whole department and unit dealing with patient safety. And when you look at the environment, the infrastructure, one of the recommendations as what the task force found when it comes to mental health services, within the 14 psychiatric units we have in this country and also the national hospital, the conditions were found to be really bad conditions, inhumane, dilapidated infrastructure, and it is seen as a way in which even people are not able to access services. It's propagating the stigma and actually the safety of the patient. So where do we move from here in terms of that's what we have found within our system, that for a long time there have not been any investment in terms of infrastructures and in terms of provision of services. And now the conversation normally moves from what is the role of the national government, what is the role of the county government, and the national government, especially when it comes to tertiary level of care, it's our role in terms of the referral services and all that. And then the counties would provide the other services. Then what is the modern way or in terms of if we are to provide mental health services? Should we put more money in infrastructure? Should we move towards putting more services in community-based services and prevention and promotion? So here now it brings the balance. And so what we have done is we'll be releasing the Kenya Mental Health Action Plan and stipulate very clearly how do you want to go about this, getting the balance. That we need infrastructure, we need services at the primary care level, at the community level. So we are working out, the national government now has committed to do a modern hospital. Actually, the new hospital will be done on a new ground. There's some innovations will be done on Mathare Hospital, but there will be a new hospital will be done. I know this is a major investment and people would say, why not invest this money elsewhere? But as a national government, we do that. And then the proposal will have 6 facilities at the various levels. One will be Girgir, which already some work is going on there. Part of Girgir Hospital will be taken up by the national government. Some of it will still remain at the Nakuru County, providing the other services. And we'll have other satellites. So the national government will do that. Then the county government will ask them to put primary care services and community-based services. And so I know this has been a question why the government want to put up new infrastructure where the role will be to move into the community. The role of the community mental health services and primary care services will be the county government. So we are planning to have a series of meetings with the county government to see that they start putting some investment. But meanwhile, we'll have some few referral facilities, 6 of them at various points, as the government is doing for cancer treatment. So that's about infrastructure. Someone asked about, did we make a recommendation in terms of the forensic psychiatric services? We only have 1 center. So we looked at it in 2 ways, that forensic psychiatric services should be decentralized also. We don't need to have a centralized forensic psychiatric services, inpatient services. So we need to decentralize this to go to the counties. People are seen at the county level, but then also to provide healthcare services within the prisons. And this leads to my other question when someone asked, mothers and children within prisons, maybe pregnant mothers within prisons, person with HIV, TB, and other. So we also need to have a very elaborate healthcare system within prisons, even providing these forensic services. So that's a long way. It's something which will require massive investment for us to move from where we are. And I think we should be able to get these resources. The other question was on still the conversation around the mental health courts, whether should we have reasonable accommodation for people with special needs, especially mental health conditions and other disabilities within our justice system. I think this is a conversation for us as stakeholders. We get a middle ground and make a decision. Do we need a mental health court? Do it help expedite and fair administration of justice with people with mental health needs? I think that's a conversation we need to have and decide on that. I know there's a provision within the mental health bill, it's still there, not there, the issue of the commission having a tribunal, which sometimes also helps in some issues because there will be a person with a legal background which should be able to help the tribunal expedite on some matters. There is the issue someone asked about, should we decriminalize marijuana because of the petty offenses and all that. The conversation about legalization of marijuana as it has happened in other countries, it's an issue which requires the population make a decision on this, and so it's a referendum issue. I always say these are issues of a referendum. But from an expert point of view, would say these are the harms from marijuana, these are the medicinal values of marijuana, and all of us stakeholders, we can have this conversation and agree maybe through a referendum what is the consensus of the country.
Thank you, Dr. for that. I believe the team has been answered on many issues that maybe were pressing. If we are okay with that, unless somebody has a pressing one, but we can continue having communication on the chat, but I believe we can come to an end to that and then move on to another presentation. because of time, because we only have 30 minutes with us now, and we have a few things to catch up with. So
Mary, thank you. I'm going to leave for another meeting, please.
Okay,
So
thank you,
I'm
Dr.
sorry for that. Okay.
Thank you, Dr. But if you have something, Dr. I hope you have, Mweni has your email, eh?
You can get to me with any other issues raised, and then I can be able to respond.
Thank you so much. Okay, now we move on to the next presentation, where we have our Deputy Commissioner General, Madam Florence, just giving us a brief on the status of special need offenders in Kenya prisons. I don't know if Madam is online. Is she available? Madam Florence. Is she on board?
Mary, I can see that she is. She's in the meeting. I don't know whether it's a matter of unmuting herself. Maybe as she prepares, or maybe as you ask her to. Oh, she has. Let me see.
Okay, may I reach her on phone? Eh?
Yes, as you do that, maybe we can be going to the next presentation.
It's okay. We can have
Somewhere.
We can have AIC looking at the gaps and opportunities on policy, legal, and other things that are there, so that we don't waste time.
Do I proceed?
Are we okay with that?
I am
yes,
ready.
please, Samuel.
Okay.
Okay, please proceed.
To unmute yourself. Yeah, there you go. Right, thanks.
Okay, thank you very much. I think Dr.'s presentation was really on spot in terms of giving some perspectives. So we coming in this presentation as a consortium that have been doing some work beginning 2018. And so this involves African Institute for Children's Studies, Camille Organization, and CAI. I think most of us had introduced themselves. I don't introduce my organization, the AICS. So my name is Samuel Munyuin, and as AICS, our interest in this is because we work in the policy arena and knowledge management, looking at improving the quality of services. We also come in from a Pan-African lens, where we believe this continent should bring together experts on various issues and be able to then influence both the quality of service and, of course, doing that through having evidence, through having appropriate policies and building capacity of the people and the institutions that deliver services. In that structure, we have what we call associates. These are experts in their own rights. They are not our staff members, but they do work and contribute. Let me just take this opportunity to take pride in one of our very senior associates, Honorable Lady Justice Martha Kome, who is also in our advisory board. So that's the kind of people who we bring together. Also in this forum, one of our long-term associate, Felicia Mburu, and really who also got AICS more into this work. I must appreciate her contribution and has played a role as a technical advisor. She's not as our staff, but rather, again, from the associate point. So a very quick mention that in the intervention that we are doing, we've called the project Modeling Human Rights-Based Community-Level Interventions to Promote Quality of Life for Persons with Mental Disability in Kenya. And there are two aspects to this project. There is the part on how do you promote access to health services, and also how do you address the needs and support people with mental disability who are living in, or rather who are in institution, especially the justice institutions. How do we support them to be able to get a community-based approach to addressing the issues that they do have? This builds on a situational analysis, which again, Felicia and a few others our team did a study in 2018, and we call it a situation analysis. The report is available, we can share. This was done as a collaborative project with the probation and aftercare department and the Madari Hospital, especially the unit where Pamela, who is in this call, is part of. We really appreciate that, and it's been funded by the Open Society Foundation and the Open Society Initiative for East Africa too. Now, we have three things that we're trying to achieve in this project. One is to enhance or improve the public financing. That's why I was asking Dr. Njuguna, what exactly are the opportunities that they see? And we will share, not so much now, but we have an ongoing process of working with the county teams to enable them to increase the public financing. Plus then to have a pilot, a model that we can use to help, those who, especially who've gone through the process of POMAC, getting the presidential pardon and all that, and being able to be taken back to the community. There's been some obstacles. Some of them have been there for very long, over almost 20 years. And we think we need to have a very practical approach beyond just having policies and being put there. And that is where then CAI is coming on board, because they have some experience working community level. The first part of public financing, looking at mental health services from a clinical approach, again, using community-based models, is being done by Camille. And then we come in because of our role we do as AICS in advocacy. We've been privileged to be part of, say, the NCAJ task force. There's one on children. And of course, we've been part of the SNO committee. And with the team that we have on research, we believe we can contribute to this. I was going to give a chance at this time to our partners to introduce themselves, but they'd already done that. So I think I can move on. Allow me to very briefly give you the situation that we found out when we did this work in 2018. I know that's like 3 years back, but minus 2020 because of COVID. I'm not sure a lot has changed. But anyway, as you heard, even as a special needs offenders committee, we've not met for a while. So I think this will still be very useful. So the framework in which we were looking at whether then our justice system is being responsive to special needs offenders, especially those with mental health conditions, is answering these criteria items that I've put there. Is it being able to contribute to what we call a reasonable accommodation? Does it promote access to health care for pre-existing conditions? If I'm in there are those who've developed conditions, and I'm going to touch on that. Does it promote, or meet the minimum standards, where one is put in detention, as would be expected within the international normative framework? And are there legal barriers? Are we active in removing those? Are we promoting a fair trial? And also being able to allocate adequate resources in detention facilities. And then, of course, having a strong monitoring and accountability, issues of data, and how do we share data across the multiple agencies that are doing this. Just some things that we did pick out, and maybe to answer at the end of my presentation, Felicia, who was our lead on this, could add in some thoughts. But you can see some figures there. While we really struggle to even get data, it's not we don't have an optimum or an ideal platforms in which we can be able to share data. I think more and more things have gone digital, which is an opportunity. COVID have shown us that it's possible to do such. But as you can see, even with this, considering some people have been there for so long, when you have 133 offenders as at that time, I'm not sure whether that has changed in the community maximum prison or persons with mental disability. And you can see that in the Madari forensic unit, then we had a total of 207, 80% were males, 20% were female. And I think the other big risk factor is based on the analysis of the data there, showing that 5% of the prison population serving long-term sentences are likely to develop mental health conditions. So I think that's really an important thing. And like I've said earlier, there are people who've stayed there for almost 20 years. Actually, I think we last year lost someone, unfortunately. So we should be able to address this as a matter of urgency. The other thing we picked up was a question of legal barriers. You know, is the law responsive? Is it consistent with the Constitution? And I think, like has been said, there are a number of things that need to be addressed, maybe through the bill. So it's good that we still have an opportunity to address that bill. Let's look at these particular laws, you know, as we've pointed out here, and make sure then that they are consistent, okay, with the Constitution. I'm not going to read much of it because, again, I want to save time. We have a few minutes. The other gap or an issue that we picked out was the question of case management. You know, just how offenders with mental disability are being treated in the entire process, you know, right from being taken into court all the way to how we manage their cases while they're in custody. Any rehabilitative, does it actually contribute to any rehabilitation? If we know, like, you know, the law says, if you know you're not able to, first of all, the offender cannot be charged with that because of that, or they've developed situations that the system is not helping them. Are there mechanisms to promote rehabilitation and reintegration? And then really there was not very effective coordination mechanism within that. And cases have taken quite long. So we think this is really a major thing. Lastly, from the situation analysis, some of the measures that were being taken 3 years back, it's a good time to take audit and see where we are at. So the legal reforms, we're still talking about the bill. It's good the task force came in and hopefully it picks up some of these things and we fast track. But I think really another reason why we need to have very regular meetings and in every meeting take stock, assign each other some tasks and make sure that we are pushing through and getting these things being done. So I think still this is the best opportunity we have in terms of the SNO committee and this platform to do this. Now, going straight into the question of then the current legislation and policy framework and what are the gaps. Let me give, what do you call it? Sort of, okay, I'm missing the word, but sort of a caution that this should have been sort of a validation meeting. We were meant to do it last year because this work has been done, of course, with the help of a consultant. We've made an attempt to verify, but there's always, you could always miss out something. So if there are any errors here, we welcome corrections and we will be able to share the full report so that you can actually type in there and give us further feedback. But maybe what's important is when I go into the conclusions, what do we think we can do? So as it says here, right from the issues of definition, how do we refer to persons with mental disability, the discriminatory around it, you know, the fact that some of it still doesn't marry up or match up with the CRPD, you know, the Convention on the Rights of Persons with Disability. And these, I think, are really important to be addressed very quickly. Certain very critical people like the probation officers seemingly not included in the mental health board, and really the need to look out for who is missing to also move away from a purely medical approach to addressing mental health conditions or disability issues, to also, you know, human rights-based, community-based, person-centered approach to doing things. And then capacity building seems to also be a gap, that we do not have, you know, very clear systems that keep improving the ability to assess cases, the tools that will bring more objectivity. And again, these things can evolve. I think I've been part of studies like in Zimbabwe that are looking at contextualizing even a community-based tool for assessments. I think these require continuous investment in research and then building capacity of the officers who are doing this and using that to ultimately inform a framework. Two other areas of gaps that I want to point out here is, okay, I think I pointed out some bit on terminology, but really still things like lunatic appearing in our law cannot be accepted. Then the other one is that the judicial system appears to be insensitive. You know, it's more adversarial. So the person being accused is expected to prove not guilty, and that is a bit complicated when you're dealing with persons with mental disability. Yet the opportunities that we have, such as legal aid, don't seem to have a very deliberate plan on how to provide that to special need offenders. especially of this category. So we think these are important issues that need to be addressed. I'll point out about 4 opportunities broadly, that there are things such as alternative dispute resolution that are more and more being embraced by the justice system. And like Dr. Njuguna said, even from the task force report, that some of the offenses that really are, persons with even mental disability will be accused of do not really warrant going through an entire legal process as such. So a bit of sensitivity within the community, providing this. I know there've been all this training being done for ODPP. How much are we engaging in stakeholders in disability rights and especially mental disability, to be able to address these matters and ensure that they become consistent. And also ensuring that our frontline team who are supporting persons with mental disability in the justice system, prisons, probation, that are continuously being supported to grow their capacity. So I think let's tap on those opportunities. Permit me to prematurely say also that the NCAJ, we think, is really a good structure. I'm happy that the incoming Chief Justice, if it goes through with Parliament, has a very good understanding of the importance of NCAJ. So I think there will be an opportunity to strengthen this. The other bit is harmonizing the legal framework. Again, even making it consistent with the Constitution, and these are the things I'm mentioning, the Legal Aid Act and the others. I think that these opportunities. There are other reforms that are happening right now in terms of, say, data management. Pre-COVID, no one will have imagined you will do your court session online. Now it's possible, but what does that require then? It requires that you have an equally information management system that is online. For the children, AICS, again in collaboration with NCAJ, have developed the Juvenile Justice Information Management System. I think as the whole digitization process is happening, can we ensure then that matters of sensitivity to persons with mental disability are addressed? The police are moving on to a digital, so to say, what we call the form that we use when, when you get arrested, the P3 forms and all these things, and even the OB being digitized. So I think those are opportunities to look at that and ensuring that this works out for us. Lastly, is that the SNO committee should provide really an opportunity really to coordinate and improve leadership. So I think us being here together is very critical. Let us have a work plan that we are consistent with, maybe even have a strategic, I don't want to call it a strategic plan, but I know we have, for example, the juvenile justice, the juveniles. Could we have something a bit more strategic, a 3-year plan, knowing we're incrementally building on the things that will help us to grow beyond what we're doing. Something else, I don't know why it's not showing. Just a moment, I pop this out. Another opportunity that I don't want to forget is that as the committee that of course oversees the implementation of the CRPD and gives based on our periodic reporting, is another very good thing to go back to. And there were very clear recommendations from the 2017 sitting. As it shows here, that the state party one shall adopt measures that all persons with disability have access to justice, including establishing free legal aid. So remember, as a country, when we go back and report as a nation, it is what me and you are doing that will ultimately contribute to this, issues of Kenya Sign Language. And so I think these are opportunities that we can go back to this and work with other state agencies, including the Attorney General's office and the relevant ministry that then reports on this, to be able to capture and see how we are gradually doing this. You can see the committee has also pointed out that capacity building should also look at judges, magistrates, and the police, and even the lawyers. So I think we do have those opportunities to do that. Lastly, as a call to action, let us have a process. We welcome feedback on this kind of studies. I know we are not the only ones doing this. Jackie Mathaga, who is here, contributed to another capacity gap. There's another work we are doing on budgeting, looking at how do we build capacity to ensure that the public participation in the budgeting process is sensitive to persons with mental disability and mental health conditions. and then ensure there's leadership. We map out resources and also strengthen collaboration. Like NCAJ, you know, the committee that is the technical working group rather, that is implementing this CRPD, and other groups like ours, plus what Faraja and others are doing. We map out what you're doing in the county. We have an opportunity as AICS, we've developed a map in which we can present who is doing what where. We can share with you a form, and you can be able to be very visible on what you are doing so that we don't duplicate. So thank you so much for this opportunity. I welcome feedback briefly, and of course my colleagues could also answer to this. Martin from Camille, Pauline and others from Kai and Felicia. Otherwise, thank you so much. Thanks to Osia and OSI for the support. Over to you, Mary.
Thank you, Samuel, for the presentation. Wow, it's a very, very informative presentation. And I believe you have done good research on areas that are very important. You know, they always say research is the mother of change, because when you are doing something with some evidence, you're able to reach people and you're able to convince people that this is practical, this is there, and this is the data that we have. And I'm happy that Samuel, you have brought out that very well. I believe that maybe people have a few areas they can highlight. Anybody with some, maybe a question, something just to bring out on what Samuel has presented. Anybody? Matthew.
Yes, Madam.
You're welcome, Matthew.
Yes. Hello?
Yes.
Thank you, Madam Kayamba. Thank you, Samuel, for such a wonderful presentation. I'd like just to ask some few questions in regard to that. And mainly in regards to this committee that is meeting here today. Basically, as people who have joined it for the first time, it's just to understand a brief about it and perhaps its mandate and the way forward. Probably from the presentation you can share with that, or Madam Kaimba can share with that as well. And also I would like to know the representation of this committee as it is, or the composition of this committee. That would also be good. I don't know if you can also mention that, Samuel, or perhaps Madam Kaimba. You mentioned something to do with the NCAJ and their work and their involvement, and how this committee deeply perhaps would collaborate with them or partner with them. How do we create synergies with them, because that committee is a bit different and this one is different, and how do you work together with them? I think just those three issues I'd be happy to understand deeper.
Okay, I think one of the questions Mweni can answer, and I think Mweni answered it in her presentation when she was highlighting the existence of the SNOW committee. Yeah, so maybe Mweni can just maybe revisit that. And if anything, the other one, I think Samuel is well placed also to respond, especially on the collaboration power, so that we can be able to understand how we can work together as a team to support this very important agenda. Wendy, are you available?
Yeah, I am here.
Okay, please.
I guess because I'm looking at some presentation. I don't know whether there's something you want to present on some, but I already, originally the committee was composed of government agencies only. Ministry of Health is represented by the Director of Mental Health, Madare Hospital, and then the Judiciary, Police, or DPP, AG, Probation, Prisons, Department of Children's Services, basically the criminal justice agencies and government health services. But as we continued meeting and making our work plans, we realize, private partnership, public-private partnership is important. And that's why we've incorporated more stakeholders, like I said, to help supplement or complement the services that we provide. I like the suggestion about bringing on board NCAJ. I know that there's somebody from the Children's Task Force, and Sam is also a member of the Children's Task Force. But this committee looks not just on children, which we acknowledge there are in population of special needs offenders, children in conflict with the law, or children in the justice system. But it also talks about adults. And so maybe those who interact with NCAJ more would be able to respond to that, how we can, I don't know whether NCAJ has as other committees and whether there is a committee that is more relevant to what we are talking about. But like I said, one of our challenges has been that legal grounding, or mandate. Otherwise, as it stands, it's based, the convener is probation department, corrections, the secretariat is corrections, actually prisons, probation, and children department, and judiciary and all that. But I think we need to have more than that, so that even when we are making our strategic plan, we are making it knowing where it is based. Yeah.
Mary, I know Rosalind Kabata is here from NCAJ, but at least from my working with NCAJ, it's that body that is giving the opportunity to coordinate the entire justice system with all the players that are here, including the police and the civil society. There are also representations, and there are several task forces that have been created from time to time to address special issues. Rosalind, do you want to put in your thoughts to it?
Yes, thank you, Sam. Good afternoon, everyone. My name is Rosalind Kabata. I'm from the NCAJ Special Task Force on Children Matters, and I work there as the program officer. Sam is also a member, and I'm glad to see him here. We've also worked a lot with Mweni from probation, who participates a lot in our activities. And I think that would be the first point of contact with this committee. It's my first time here. And I'm actually very pleased to be here because I didn't know there was a special needs for children committee, and we've been grappling with this issue of special needs as the task force because it's one of our TORs in the Gazette notice that established it. And I think this can also form part of the discussions we can have with this committee as a collaboration. And one of our TORs was to develop guidelines for children with special needs and to develop guidelines for inclusion of children with special needs, where we should have now SOPs or practice guidelines for the child justice agencies. So I think this is answering the question of how we can collaborate or have contact with this, the NCAJ Special Task Force on Children Matters. And from the presentations I've had, I'm sorry I joined in late, I was in another meeting. I can see there's a recommendation to establish, I think it was the courts, the special courts for, I think, people with special needs. Someone can please let me know if I mistake the name. And I have several questions just to help me understand maybe where this committee is coming from and maybe what you'd want to achieve and how we can create a synergy. One, special needs, I understand, is a very broad name. And then there's mental health or mental disability. So that too, I'd like confirmation about. So if then the committee would want the mental courts, the mental health courts, or the courts that are unique to people who have special needs or struggle with mental health, I just like to understand if it's children in conflict with the law or children who are in need of care and protection, because there are categories of children, and the children court handles all of them. So is the issue more so to identify the child with special needs or a mental health issue, or is it the infrastructure or both, or the quality of care? And because I know for children in conflict with the law is clear that if you have a mental health issue, if the court can show, or if you have a mental assessment and it's shown that you aren't able to make a decision that led to you committing the offense, then you're not liable. So at least the court has that jurisdiction to make that decision whether to go on with the case, if in case of a child. But then the child in need of care and protection, then I'd want to know how, is it the fact that it is the court that is dealing with it that has a problem, or you want to establish another court? Because there's also the protection and care form that the Special Task Force came up with, and maybe could help in identifying these children and then identify how to help these children. And I also know there's no infrastructure or government infrastructure to help these children. So I just want to understand exactly where we are going so that I can see how we can collaborate together as a task force. So one, the definition, and then is it about the recognizing the child in the justice system who has special needs and how to deal with them, or is it about the courts that are dealing with them, and what will be the jurisdiction for the courts in case you want to establish a separate court? Yeah, but I'm learning a lot. I'm sorry, I have so many questions, but if you can enlighten me, I would be happy. Thank you.
Thank you, Rosalie. I think you have highlighted so many things that we also need to think through as a committee and bring them out for you to understand, so that we are able to provide the relevant support to make sure that whatever the gaps that we have in respect to especially children in conflict with the law, and even children and protection, all of them suffer almost the same challenges. Yeah, because there's no child under care and protection who is well placed. You find that even where maybe they are being held is not as fair as what we expect. And even those now in conflict with the law, the same thing. So as a committee, I believe that is one of the things when we sit next time, we need to bring out all these these challenges that you are bringing up, so that we are able to feed the different people, the gaps that are there, for us to see how we can implement and improve the services for these the special need offenders. And I'm happy when I looked at, normally I always look at opportunities that are available. So when Samuel brought out all these opportunities that are available, maybe we need to look at them and say, how do we capture? And you are being here as NCAJ is an opportunity for us. So we need to capitalize on that and see what we can do to make a difference. So I believe that is very important. And Matthew, I believe in the area of what the composition of this snow committee, you have been told, and now you are one of us. So we believe you'll have a role to play in one area or another, depending on your concern. And I believe those are the areas that Matthew was talking about. I don't know if there's anything else that somebody needs to bring up. I've seen Dr. Orlando has raised his hand or her hand. I don't know if he's see or Dr. Orlando.
Yes. Thank you for this opportunity, and thank you for the good presentations. As I listen in, it's my first time to attend this, and I'm thrilled that such a thing exists. Actually, that means actually our aim of reaching the needy is real. So as together we can achieve a lot. I've been last year. I joined a committee called Power of Mercy committee. I don't know if we are aware of it. That committee that advises the president on who to extend to mercy. Yes. So currently we're just going into the fields and collecting information from people and key stakeholders to understand whether people are aware of this committee or that power, and what people would want to be changed, what additions, what subtractions, is it serving, is that power by the president serving us well? And I look at this special needs group as key people who can benefit from that mercy, and I don't know if we really see them benefiting or that things we would want to change. So maybe I would throw the challenge to the convener of this meeting that if there are things you would want heard by that committee so that they incorporate in the new changes, maybe you could forward so that we tell them before they concretize the report back to the president. Yes, that's my.
Mary, just to respond to Dr. Orlando, I believe you're the next soup at Mathare Hospital.
Sorry, I'm representing the med soup. I'm Dr.
Oh, you're representing. Oh, okay, yeah, because Mathare Hospital has always been a member of the Special Needs Offenders Committee since 2010. I guess it's because of, the different kinds of changes. So you are bona fide members of this committee. We cannot do without Mathare because that's where a majority of our clients who we are actually discussing a lot are based. And the Power of Mercy Committee, probation is a very key player of that committee. So of course, we can be able to engage with it because some of these issues that face this clients are actually because of the actions or inactions sometimes of the Power of Mercy Committee. If you go to that wing, you'll find people have stayed there for years waiting to be released from that wing, and they haven't been released. Maybe that contributing to more distress in their lives. So yes, if the committee is going around collecting views, just like the way Dr. Juguna talked about the bill in Parliament, advocacy is one of our objectives as a committee, and so we will be willing to give our views as stakeholders, the same that we are going to organize for a meeting with NCAJ through Kabata and Sam, so that we can also see how to be able to continue working. Yeah, I guess I'll say that. So now that we have our representative there at Mathare, who is a member of the Secretariat, my colleague Pamela Onyango, maybe you can coordinate and just let us know, and we'll be able to organize a meeting with this committee so that we can give our views or interact with FOMAC.
Okay, thank you.
Thank you. And I think what Dr. Orlando has brought up is very urgent because there are issues that we need to bring out, especially when we are looking at the Power of Mercy and also the area of the releasing the people who have been in Mathare or whatever, this type of the special need offenders, the mentally challenged. I feel there's something that needs to be addressed differently. Because right now, if they are saying that they cannot release people, Power of Mercy cannot release people with the psychiatric whatever, do they expect this person to actually die in prison? And there are some of them who have really recovered and they need to be supported to reintegrate back to the community. So we need to actually look at that area seriously. So Pamela and NCAJ, and I don't know the area we have just been talking about repeatedly when it comes to the legal backing of the committee that we have. We also need to push that. I don't know how NCAJ can help us in that respect so that we have a legal backing, yeah, instead of just existing because we are just trying to bring together issues that we feel have been left out in the area of special need offenders. Now, Winnie and Sam, advice. When are we supposed to be finishing this meeting?
It seems like we have actually gone into the plenary, which is fine. The meeting was supposed to end at 1. We are 14 minutes.
Yes.
So probably if you can say something about prisons, and then we just wrap up in the next 10 minutes. For me, I think that would be great.
Now, Madam was on and she said she's coming she wanted to say something. I don't know if Madam Florence is back. I called her, she said she was on board.
She's in the call. Okay, she's unmuted now.
No, I'm on board.
Oh, Florence.
Thank you.
I've been looking for you.
Okay, we are waiting for you just to say a few words about special need offenders in Kenya prisons. Then we finish up the meeting.
Thank you very much, Mary. Thank you, Florence. Thank you, Dr. and everybody. This is a momentous time for us, especially the ones who are handling special needs offenders in our different institutions. Now, for us in the Kenya Prison Service, CAP 9 really does not come out explicitly to say anything about structures.
Mary, mute yourself, sorry. No, I'm telling Mary to mute herself. Sorry, proceed.
Thank you. So, I know Mary has already outlined the different categories of special needs offenders we have, but some of them are really unique and fragile, very, very fragile and vulnerable. Daktari has talked about the mentally challenged, especially the ones in Mathare. I think it's high time that we use this platform to come up with that exit strategy to address the issues that affect the mentally challenged offenders, especially who are in Mathare, and how we want to deal with them after they leave the hospital. Some of them have lost touch with their families. Some of them have been there for too long. They've lost memory of anything. And it will be important for us to come up with what we then do with them after they have left Mathare. We also have some inmates who have been with us, and over time now they've developed issues, mental health issues. We also need to come up with the structures of handing them over to whichever organization. I do not know which one this is because some of them may not be accepted back home. Some of them may have lost even their people for the time they were in our institutions. The capacity of our institutions is overstretched. And this is capacity both in the space and in human resource. So we also need to address this. We have one category that I have always thought should not be with us, and this is the sexual offenders. Really, I know we want to protect the community, but I don't think that we have capacity to handle such in our institutions. Because we also need to take care of the other people, because a sex offender is a sex offender, whether they're in prison or outside. So we really need to think in terms legally. We have to have them in prison, or do we have to have them in another institution where they can be assisted, where they can be rehabilitated, and where they can be reintegrated smoothly in a very, very seamless way. Another category who are not offenders but happen to be in the institutions is the small children, the children born in our institutions. They are not offenders, but they find themselves in the system because of the parents. Now, I want to believe that as they continue staying in the institutions, they get mentally affected because that space is not for children. And therefore, we also need to come up. Do we really want to retain them there up to the age of 4? Do we need to come up with facilities for mothers who have children so that they're in a facility of their own with the children under CAP 9 still? Or what do we need to do with these ones? And I only want to deal with those ones, the mentally challenged, the children, and the sex offenders. So I know that as we go on with this conversation, we will come up with structures that will adequately address the unique needs of the special needs offenders. Thank you very much. Asanteni sana.
Thank you.
Yes.
Mary, uko wapi?
Mweni, I'm here.
Yeah. Okay.
Thank you, Madam Florence, for the highlights. I believe you have informed the partners that very well on our areas. Remember, we actually hold a very big proportion of the people who have challenges. And I remember very well when Samuel was presenting, I talked of, is it Samuel or one of the people, Dr. or Samuel, that quite a number of people who have mental challenges are petty offenders. And remember, if I'm right to follow up on what Madam has commented, actually 3/4 of our prisoners are petty offenders. So you can imagine the population that we hold. And I'm right to, I agree with Madam when she says, we really need personnel, we need facilities, we need so many things that will really make the environment better for them. Thank you, Madam Florence, for that. We appreciate and we acknowledge your support and commitment. Even when you are busy, we are happy that you're able to make time just to come and sit with us through this. And I know this is your passion for a very long time. So thank you so much, and thank you, Madam Florence,
Thank
for
you,
that.
Mary. Thank you very much, colleagues.
Yes.
Can I say something very brief, Mary, kindly?
Yes, please.
Asante sana, Florence. It's good we've worked within the task force. I know your passion. I also want to appreciate that as prisons, you've been very open and had even MOUs with us as the consortium to help reintegrate. I think there is a nexus, there's a connection between POMAC and that process of then how do we move forward. And I think speaking to stakeholders in our own research work, there seems to be some bureaucracies, and I've texted Dr. Orlando, and I'm sure even others who work in POMAC. We really want to have a very honest conversation. Shida iko wapi? Because really, even if we are going out to collect more information, I think the law requires that within 30 days of writing a recommendation to the office of the president, there should be, a clear feedback and then release those people, because your process is scientific, so to say. You're not just doing things emotionally. Why is that not happening? Because without that, it's difficult to release those who need to go and get a community-based care or even complete their sentence within a community-based mechanism. Plus, we are afraid of those who are coming in, but remember, we already said about 5% of people are at risk. So if you took the prison population today, especially those who've been there on long sentence, 5% of them at risk. And remember, the more you stay in situations where your mental health conditions are likely to even get worse, you're going to increase those numbers. So we really must have a very practical process, and it looks like the bureaucracy of the communication between POMAC, I don't know if it goes through the AG's office, needs to be streamlined, and how then the Commissioner General at prisons then uses that information to be able to release people. Really needs to be streamlined and urgently. Thank you.
Well, I really agree with you. This needed to remove this bureaucracy and to inform people appropriately. Because when you look at us in prison, we are the people who hold these people for 30 years. And the more you put them in that bad environment, the more likelihood that they'll continue feeling depressed and stressed and mentally sick. So we need to actually look at it and say, what is it that we can do and support this person go home and reintegrate back in the community. And more so, we work with the probation. So the probation report can really give a backup and say, we have looked at the family, despite the fact that this person is mentally challenged, this person has a family that can give him a backup. And we believe when he's out of prison, he can even heal faster. So I believe such a thing should be put in place. I agree with you, Samuel. We need to have an open discussion to make sure that such a things that hold people inside prison because of bureaucracy and because of not even understanding and having lived with the people. You know, maybe those of the people who are deciding have not lived with these people in the institution. We have lived with these people in the institutions. We know what they go through, and we believe we even know what can be more useful for them instead of leaving them back in, stay more in prison. So thank you so much. I believe we have talked and we can talk for a whole day. So maybe we need just a whole day to, now that we have started, to really brainstorm on all these issues that we have raised today, and give more, get more information, look at the gaps, look at the challenges, look at all these things that have been brought forth for us now to have a paper or a backup on what can be done, because we are the implementers. We have the research people within us. We have the people who provide the services. We have the doctors, we have the social work, we have everybody. And every one of us, when I was listening to the introduction, they have a passion for people with special needs. They have a passion with people with special needs. So it is important and it is necessary that we continue with this meeting. And more so, I don't know many, now that we had established the 4 areas of group so that we are able to move within that group, how the team can be able to identify themselves with a different group so that now people can work within those groups, as much as we still maybe need to have a forum again to see what we can move forward with.
I think the secretariat, the small committee, can organize people and get back. We will pick the main points that were mentioned, with some of them that look like way forward, and then organize people, because if we start doing that now, we will not finish, and then probably have another meeting in the next 1 month. Like I said, we want to now continue meeting until, you know, as much as possible, so that we can start getting things back on track. That would be my suggestion.
Thank you, Mweni, for that. I believe that is in order. And the secretariat maybe will get back to the members now. I believe everybody has registered themselves to their emails, so that we are able now to give you the feedback, the information that we have. And more so during the secretariat meeting, we shall be able now to establish exactly the groups of the type of groups that we shall be having, so that in the process we can say, when we send you an email on the same, you can be able to identify yourself in every group that you feel you fit, so that now we develop themes within the groups in areas that we have discussed, so that we come up with an implementation plan, because we need even to develop a work plan of how are we going to go about this in the long run. Because let's not just be talking, because the people who need our services need them now. It's just that sometimes the working restricts us to take a lot of time thinking through. But if we could be able just to say, this is what we need, we are able to train people in this area, and we go ahead and train people to improve the services, that would be our passion. That would be a big actualization for us. So I believe that the secretariat is going to meet and then decide on, work out on some sort of a work plan, and then feed the committee members. And if there's anything the members present today have and they need clarity, they can reach Mweni, they can reach Samuel, so that they are put in place. Because we are supposed to finish this meeting at 1. Now we are going to around 1:30, and some of us will be going into other meetings around 2 o'clock. So we wish that maybe come to an end. I don't want to ask anybody for any other business, because that is not professional these days for meetings. I just want to say that we come to an end, And I wish everybody, every one of us, the best for having joined this very important meeting. And I'm glad that we are over 30 something, meaning we have, you know, we have the drive, we have the motivation, and let's push it up for the well-being of the people who matter. And let's read the report, the task force report. It is very important, it's very informative, and we can also use it to back up our implementation plan. Thank you so much, and be blessed.
Thank you. And as the others check out, can Mary and Samuel and Pamela Onyango please remain behind? Hapo nyuma ya tent for a minute. Thank you.
Watu wa Nairobi, sawa, thank you. Thank you, everyone.
Watu wa Nairobi.